State-of-the-art technology and equipment play an important role in our healthcare simulation. From our healthcare mannequins to our simulation-based electronic health record system, these tools make the simulation as realistic as possible while ensuring a safe and controlled environment. Across the hall from the high-fidelity simulation labs, you'll find our medication room, which includes an Omnicell machine or automated dispensing cabinet. This machine is used in real practice settings, enabling our students to engage with technology they will one day use in their daily work. In addition to this technology and equipment, our Experiential Learning and Simulation Center also provides opportunities for students to engage with standardized patients or individuals who are trained in the case and prepared to act out symptoms or scenarios. We recognize that while technology, like our healthcare mannequins, supports a safe and controlled environment, students need to gain experience with real people. Let's pick up the case with Mr. Adamson, but this time in a new space, our acute care lab, and with a standardized patient. Mr. Adamson was admitted to the hospital after his visit to the emergency department. He's been in the hospital for a few days, and he's been told that he will be discharged later today. Kathy, our pharmacy student, has reviewed Mr. Adamson's case, and she's been asked to talk to him about his medication, warfarin, before he is discharged.
So your medication warfarin is a blood thinner. It should prevent you from having another blood clot like the one you had about a week ago. The dose we have you on now is 5 milligrams per day. That may change at some point, but that'll be the dose you'll take until your next clinic visit. I saw on your medication list that you're taking carbamazepine twice a day. Is this correct?
Yes, ma'am, it is.
Okay, then I would recommend you take your warfarin maybe later in the day, probably around the time that you take your second dose of carbamazepine.
Okay, I can make that happen. I can put it in my pill box.
Yes, sir. That would be great, since it is very important that you take this medication every day and try to take it around the same time each day.
I can do that. Now, I need to tell you, I take a multivitamin and also a Aleve. Are they to be continued?
So the multivitamin should be fine. The Aleve, however, can interact with your warfarin. Does Tylenol work for your pain at all?
I believe it does.
Okay, that would be a better option than Aleve to avoid that interaction.
One of the benefits of engaging with standardized patients is that students can gain experience interacting with diverse patients. In this interaction, the conversation flowed smoothly, but in another, the standardized patient may act more confused. Or realistically, he may not recall the other medication he is taking. Like the simulation in the high-fidelity suite, this lab provides a realistic environment for the scenario. The room includes a real head wall and hospital bed, and realistic props, like an IV pole.